everyone for joining in. And it would be great if you can please keep posting your questions in the chat box section. आपके कोई भी सवाल आते हैं इस टॉपिक को लेकर के, तो आप अपने सवाल चैट बॉक्स सेक्शन में भेज सकते हैं, जिससे डॉक्टर डॉली आज के सेशन के एंड में आप सभी के सवालों का जवाब दे सकें. So I'll just quickly bring up my screen and we'll start today's webinar. Thank you so much, everyone. So namaste, sat sri akal, salamu alaikum, and a very fresh good evening. This is Sanghamitra, leading the care management team at Zyla Health, and I'm your host for the evening today. To start with, and for a quick introduction, Zyla Health is India's leading AI-powered health management platform that is serving 5 lakh plus patients in 595 plus cities and happens to be the highest rated app with a rating of 4.8 and delivers 24/7 care. We have been helping people with multiple health conditions such as COVID, diabetes, heart issues, kidney health issues, and women's health issues through a very able and experienced team that is in-house at Zyla for the highest quality care. So as we all know, monsoon season has arrived, and while most of us like this season, along with it comes few common infections or seasonal diseases which are water, air, and mosquito borne. So today let's know in detail about those diseases and how they can be prevented. And for this we have with us Dr. Dolly Bagai, who happens to have 3+ decades of experience and specializes in family medicine. Dr. Dolly has been previously associated with Safdarjung Hospital, Delhi as well. So welcome, Dr. Dolly. We are very delighted to have you among us today on this platform for making us understand about this webinar, and looking forward to this insightful, informative session with you. Everyone, if you have any questions, आपके कोई भी सवाल आते हैं वेबिनार के दौरान, आप चैट बॉक्स सेक्शन में अपने सवाल भेज सकते हैं, या आप सेशन के एंड में डॉक्टर डॉली से अपने सवाल खुद भी पूछ सकते हैं. Over to you, Dr. Dolly.
So good evening, and on behalf of Zyla Healthcare and my co-host Sanghamitra, I welcome you all on this season of love, monsoons, most important webinar talking about its various diseases. As you understand, monsoon is said to be the season of love because everything comes back to life. The plants get their required amount of water and वो खिल जाते हैं. The trees, the valleys, the rivers, the animals, the fishes, the nature, it just livens up, and it's the most romantic season of the year. But along with the most romantic season of the year, we also get to see some major health issues. And these 4 types of major health issues I shall be dividing into mosquito-borne, food-borne, airborne, and skin-related problems. Why I'm talking about the mosquito first is because the mosquito-borne illnesses are the most rampant during the monsoon season because of the breeding of the mosquitoes and sudden increase in the density of the mosquito population. So the first disease that we are going to be talking about is malaria. As you must have all heard about malaria, it is caused by a female Anopheles mosquito which breeds in dirty, stagnant water, and the symptoms include high fever with chills. You can see the patient shivering and trying to put on him or herself 2 to 3 to 4 blankets, and still under those 4 blankets, the patient shivers and shivers and shivers. There's a bad headache, there's vomiting, there is body ache, and the fever comes on alternate day, or it comes at the same time on the next day. So this malaria in Indian subcontinent, in the northern subcontinent, is a very important mosquito-borne illness. The second one, as you all understand and you are familiar with, is the dengue fever. Here, have a look at the picture of the mosquito. This is called the tiger mosquito. See the big size of the mosquito. Please focus on the picture of the mosquito. And it is called the tiger mosquito because it has stripes on its body and on its tentacles or the legs. See the striping, and the size of the mosquito is extremely big. It is much bigger than the Anopheles, which causes the malarial fever. And it is called the Aedes mosquito, and it's a day biter. The symptoms include fever, joint pain, and very, very low platelet count once the fever starts receding. And there is a lot of body ache. The patient keeps saying he's getting a lot of body ache, bone ache, muscle ache, and fever with chills, rigor, vomiting, joint pain. And of course, the most important hallmark of dengue is the low platelet count. The third mosquito-borne illness is the chikungunya. The chikungunya is caused by the same mosquito, that is the tiger, Aedes mosquito, which is again a day biter. And the symptoms include fever, joint pain. Here, the hallmark of chikungunya fever is joint pain, which is severe and disabling, and it can last for months. The person is not able to walk straight, he will bend forward and walk. This is the hallmark of chikungunya, the joint pain, the muscle stiffness, which is different from dengue, which is characterized by low platelet count. But in dengue, there is not so much of joint pain and disability as in chikungunya, and therefore it is known as the breakbone fever. What are the tips of prevention? Firstly, as you understand, the mosquito breeds in stagnating water, dirty water. So we need to control the breeding. And how do we control the breeding? We prevent the stagnation of dirty water. We should empty out our coolers or any container which is containing stagnant water and which has not been changed for a number of days. Empty water holding containers, all these need to be cleared out and dried up. Coolers, buckets, plant pots, anything which can hold water, please empty them out and dry them in the sun. The second most important tip for prevention for the children who go outside to play is to wear full sleeves clothes along with socks so that the mosquito is not able to bite at the feet in the grass. Use mosquito repellent spray, mosquito repellent cream, mosquito net on windows, or good night भी आप जला सकते हैं. And it is very important to control the breeding. So it is extremely important to maintain a good, well-lit, hygienic surrounding. The second most important monsoon illness are food and waterborne illnesses. Illnesses occur due to consumption of contaminated food and water. Those of you who are living outside Gurgaon or probably in Delhi are getting messages of low water supply. Water supply is hampered because of the contamination in the water, which makes it unfit for drinking. Therefore, what do you do? And of course, the rural population is more at risk because they do not understand the importance of good quality or hygienic water. They take their water from the well or the nearby pond without treating it, they drink it. So it's extremely important to educate our rural population, and in the cities, we need to see whether our water is contaminated or by any sort of a sewage mix or any other contamination that is occurring in the water. So please buy clean bottled mineral water which is fit for drinking. It commonly presents as diarrhea, fever, abdominal pain, nausea, vomiting, loss of appetite. Here I also want to emphasize, please get your overhead water tanks cleaned and get your ROs and filters serviced in time, because these filters and ROs which are left unserviced are also a breeding ground for contamination of water. What are the common food and waterborne illnesses? I will go in order of most frequently encountered by us clinicians. Typhoid fever. It is caused by a bacteria which is called as Salmonella typhi. And how does it occur? There is contamination of drinking water with sewage. What are the symptoms? The symptoms include high grade fever, diarrhea, fatigue, poor appetite, and the fever is extremely high. It is not breaking. Normally, routinely, fever breaks, but in typhoid fever, the fever does not break. And therefore, one should get very suspicious and get oneself tested for typhoid fever. The common food and water-borne illnesses I am continuing to talk upon now is hepatitis A. Hepatitis is a viral disease. It is caused by a hepatitis A virus. And how does it spread? It spreads by contaminated food and water consumption, same as typhoid fever. Symptoms include jaundice. And before jaundice sets in, there is fever with chills and rigors, upper abdominal pain, nausea, vomiting, loss of appetite, and then comes the yellowness of the eyes, the skin, and deep yellow urine. The third one I want to talk about is cholera, which is pretty much dangerous. It is caused by a bacteria which is called as Vibrio cholerae, and there is intense vomiting, intense diarrhea, and severe dehydration. The dehydration sets up much faster in cholera than in any other disease. See, I have made a chart to understand the color of the urine, and as you can understand, the lighter the color, the better it is. But the darker it becomes, it shows that there is severe dehydration occurring in the patient. Nausea, vomiting, uncontrollable, electrolyte imbalance, and patient may land up in shock and dehydration. So we have to recognize cholera on the symptom of its severity. There is severity of the symptom of nausea and vomiting, uncontrollable. Aap kuch bhi kariye, the patient is throwing up and passing stool at the same time. The stool in cholera is rice colored stool, white stool. So if the patient says, I'm passing rice colored stool and he is vomiting incessantly, immediately get him treated, take him to an infectious disease hospital, because cholera is a notifiable disease and is treated at various government centers only. What are the preventive tips? The most important, since I am talking about food and waterborne illnesses, you have to ensure clean drinking water. And I always request my patients to warm the water near to boiling temperature before and cooling it, and then drink it. Use of water purifiers, get ROs, get filters put. Carry your own drinking water to prevent illnesses. You do not drink water from outside. Do not drink water which is available on the roadside. Wash your fruits and vegetables. Here I will go a step further. Wash your fruits and vegetables yourself. Cut your fruits and vegetables yourself, because I have seen in a lot of households which the servants are handling the fruits and the vegetables, the owners, they keep falling sick because the hygiene level of the servant is not as much as that of the owner. So again, a humble request here that please wash your fruit and cut it yourself before eating. Cover your cooked food in order to prevent flies, and wash your hands frequently to maintain hygiene. Another important preventive tip is to get vaccinated for hepatitis A and typhoid. These are easily available vaccines in the National Immunization Program. Please go for typhoid vaccine. We have highly purified vaccine by the name of typhi.cv, which is a typhoid conjugate vaccine. Hepatitis A vaccine is available. It is given in 2 doses, 6 months apart. Typhi CV is given once in a lifetime. You can repeat it later. But if you are getting a cheaper vaccine, which is the Tyvar, you need to get it every 2 years to boost up your immune levels. Do you know that hepatitis A vaccine is 95% effective against infections, and it provides immunity for up to 20 years, which is a long immunity. Efficacy of typhoid vaccine is between 50 to 80%. Therefore, I am requesting to get a repeat dose after every 2 years, and always practice safe eating and drinking habits. Here, I want to add another point. Children who are going for swimming need to be vaccinated for hepatitis A and typhoid, because water contamination of the swimming pools will land your child into hepatitis A and typhoid. And since these are both preventable diseases, please get your child vaccinated for typhoid and hepatitis before he joins his summer course of swimming. Then the third comes is the airborne illnesses. The airborne illnesses during the monsoon season are transmitted by respiratory droplets. And here we have common cold, influenza that we call as flu, and COVID-19 now, which is topping the list. These airborne illnesses are extremely contagious. A family may, if you are in a close vicinity, all of them get infected. Easily spreads from person to person. The whole family is down with flu, common cold, or COVID. The symptoms include high-grade fever, body ache, cough, difficulty in breathing if it progresses to pneumonia, and extreme fatigue, muscle ache. These leave you extremely weak by the end of the disease. So how can we prevent the airborne illnesses? We can prevent the airborne illnesses by wearing a well-fitting mask which covers both the nose and the mouth, and avoid crowded public places. Something for the home is open your windows and improve your ventilation, and let sunlight enter into your rooms, so that sunlight, it disinfects your room. Or you can also use an air filter inside your room. Follow all the local guidelines while traveling, congregating in public places. And please get yourself timely vaccinated for the flu, the COVID booster, which now Modi ji has said it is a precautionary dose. It is a dose to build up your immunity. If you had your second dose 6 months back, please go for your booster or preventive dose shot. The other preventive tips is that if you have symptoms like cough, cold, body ache, fever, please consult your physician and get tested promptly for flu and for COVID-19. If you have come in contact with someone who has tested positive for COVID-19, isolate and test yourself in order to avoid spreading it further. And I'm again repeating, please go for your booster or preventive dose shot. The fourth important is the skin infections. Since there is so much of heat, humidity, and moisture, the fungus, they are extremely common. The fungal infections are extremely common due to increased humidity and moisture. And we get what we are commonly called as athlete's foot. That is, in between the toes, you get the skin becomes very pulpy and white, and it loses color, and it is itchy. Ringworm, fungal nails you also get, which become dry, brittle, and lose their color. The common sites are in between the toes, around the buttocks, and in the axillae on the armpit. Why in these places? Because there is approximation of the skin, and there is heat and humidity, which is a perfect environment for fungus to grow and propagate. They are now here comes the most important point. These fungal infections, they are contagious. And how do they spread? They spread due to sharing of personal items like towels, wearing wet clothes, and wet socks. So, my humble advice is not to share your personal items like towels after having a bath, put them out into the sun to dry, and so that it is not going to reinfect you also, because it is containing the fungus, and if you don't dry it or you don't wash it properly in hot water, the fungus remains in the towel, and once you again use the same towel, the fungus comes back onto your skin. Do not wear wet clothes. If you are washing clothes by any means, the clothes become wet, please change after getting wet in the rain. Change your clothes. Wet socks, this is the danger point. Wet socks. Socks need to be changed, need to be cleansed, need to be washed in warm water, and changed. Your shoe needs to be dried out in the sun. How will you manage the fungal infection? Consult your physician. Keep your affected area clean and dry, and use antifungal dusting powder. Leather shoes, इनमें बहुत fungus हो जाती है. Please dry them after, on a weekend or on a Sunday. Dry your shoes out into the sun. Change your socks morning, evening. If you're sweating, please change your socks and do not wear them before washing them and drying them. The other contagious skin infection which I get to see in my clinical practice is scabies. It's horrible, I'm telling you. It is caused by a parasite which is known as Sarcoptes scabii, and it is extremely contagious. Again, the whole family gets infected with scabies. They come itching like monkeys, and severe itching, rash, and they get bruises due to so much of itching. See the picture, the patient is all the time scratching him or herself. Consult a doctor immediately to begin treatment of the, please note, entire family, in inverted commas open and inverted commas closed. Even if single member is left outside without treatment, he will reinfect the whole family. So it's extremely important to call and counsel the whole family, make them sit down in front of you and tell them how to get rid of their scabies, by every member of the family practicing the scabies protocol on the same day. This is extremely important. What do you have to do? You have to wash your clothes and bed linens in boiled water. You have to apply permethrin at night. You have to apply, you have to spare your private parts and apply the permethrin ointment below the neck, in the armpits, and in the web of the toes, and in the finger web, and have a bath with warm water next morning, and boil all your clothes that you have been wearing in the previous night with, not boil, but warm with warm water, and set them out in the sun to dry. But all the members have to practice this protocol on the same day. Let us talk about some non-contagious skin infections. And here I see a lot of eczema propping up during the monsoon. It is a non-contagious skin eczema. There is itching, there is redness, there is inflammation of the skin. Eczema flare-ups are common during the monsoon season. So please change your sweaty clothes immediately. Whatever is triggering the eczema, try to stay away from the trigger, avoid hot water baths. And now I am walking away from monsoon diseases which are contagious, but at the same time, which are extremely important. One of them is conjunctivitis. We get to see a lot of viral and bacterial conjunctivitis, and there is inflammation of the sclera of the eye, and you need to put antibiotic and lubricating eye drops, avoid rubbing the eyes vigorously, sharing personal items, wear specs, wear dark specs, stay away from people, wash your hands, maintain hand hygiene, and wipe your eyes with a clean tissue roll. Don't use a handkerchief, because if you keep repeating the same handkerchief over your eyes will never get okay. So please use a tissue and keep throwing, or you can use sanitized iPads and clean your eyes and throw them. Most importantly, we at our level, we and in a government hospital where I have been trained, we get to see a lot of electric shock during the monsoon season. It is due to the waterlogging and the fallen power lines in the rain. And there is leakage, कूलर के तार से लीक हो गया, पंखा का तार लीक हो गया, कमरे में पानी भर आया. This is the low socioeconomic strata, because I was in Safdarjung hospital. एक ही कमरे में सब कुछ करते हैं, एक ही कमरे में सोते भी हैं, खाना भी बनाते हैं, रहते भी हैं, और सारा इलेक्ट्रिकल सिस्टम सरकार का वो तार लगा लगा के करते हैं. Lot of naked wire is lying around. The children step on those naked wires, and during the monsoon, these accidents are bound to occur if people are not careful. So we get to see a lot of electric shock, and in people who are having servants, advise them how to prevent getting electrical shock to their servants. Never touch the plug with a wet hand. I will take a little more time. I want to stress on the fact that during the monsoon season, this line is for pet lovers. Pet lovers need to pay attention, because the dogs and the cats that they have as pets, they breed ticks in this season, and these ticks can sometimes climb onto you and give rise to what is called as tick fever, and in our language it is called as leptospirosis. So please be careful, see for any tick which is clinging to your body if you have dogs and pets at home. And the same. There is high. One is the hand, foot, and mouth disease that we are getting to see in a lot of infants and toddlers and school-going children. These are the children get sores in their mouth and in their hands and in their feet. You need to be aware if there is a hand, foot, and mouth disease outbreak in the school, the teacher, the school authorities will inform you, refrain from sending your children to school. Most important burning topic now, maybe not related to monsoon, is the monkeypox. The monkeypox, as you all understand, smallpox was eradicated in 1984. And therefore, after 1984, nobody, not our children who have grown up now, probably young adults, have not got the smallpox vaccine. It used to be given in our schools. We used to be made to stand in a line, and there used to be a spirit lamp where they would, heat up that smallpox needle, and they would put 2 smallpox needles in your left arm or in your right arm. People who are older or people who are young adults, they will ask their parents about the smallpox vaccine. You can see the mark on the left or the right arm. There always used to be 2 marks, and this smallpox vaccine was given in our school days. So this virus has mutated, and it is now coming in the form of monkeypox. You get fever, you get headache, you get whistling, but you get lack of energy. Just a minute, excuse me, please. Excuse me. Chalo, good. 1 minute, please. Chalo.
Extremely sorry, guys, everyone. Dr. Dolly would be joining us again. If you have any questions in between, if you have anything that you want to share, please put down your questions in the chat box section. Yes.
So I was talking about monkeypox. I want to just tell you one thing about monkeypox. It is mostly seen in the LGBTQ community. And the first case in India was reported in Delhi. The person went to Himachal Pradesh for a stag party and has come back with monkeypox. So it was reported first in Congo and then down south, and then the first one in North India was reported from a person who went to Himachal Pradesh for a stag party, and maybe, as you understand, and he's come back with monkeypox. After this, I want to share one another point. If you get fever, tell your doctor about your travel history, please, where you have been. Then we can look up what disease was occurring in that region. And it gives us a help that the travel history, we can look up what is happening in that city or country, and maybe we can correlate and help to make a diagnosis of the fever that you are getting. Sangha, can I have the next slide, please? I have a few takeaway points. I wish to say that 2 or more diseases can coexist. It's not कि केवल मलेरिया, बहुत से पेशेंट्स मेरे पास आते हैं, डॉक्टर साहब टाइफाइड हो गया. अच्छा, कैसे पता टाइफाइड हो गया? टाइफाइड का टेस्ट कराया, पॉजिटिव आया. ओके, क्या टेस्ट कराया? ओनली टाइफाइड. अरे भाई, सीबीसी कराया, यूरिन कराया, एलएफटी कराया, डेंगू कराया, मलेरिया नहीं जी, वो तो कुछ नहीं कराया. बस मेरे डॉक्टर ने बोला टाइफाइड का टेस्ट कराओ, मैंने टाइफाइड का टेस्ट करा लिया. हर आदमी आज की डेट में टाइफाइड की रिपोर्ट लिए घूम रहा है. टाइफाइड दो प्रकार से टेस्ट होता है. या तो तुम विडाल टेस्ट कराओ अगर फीवर इज मोर देन 7 to 8 days, या तुम typhi.igm कराओ, which is much more sensitive. The most sensitive test for typhoid is the blood culture, where you grow the bacteria Salmonella typhi in the blood, and therefore you confirm that the person has typhoid. लेकिन वो पूरा पिक्चर नहीं मिलता उसमें. So my humble request is to get a fever panel done. उसमें सब कुछ कराइए, उसमें सीबीसी कराइए, उसमें प्लेटलेट कराइए, उसमें डेंगू कराइए, उसमें टाइफाइड कराइए, उसमें मलेरिया कराइए, उसमें यूरिन रूटीन कराइए, उसमें एलएफटी कराइए, सब कुछ कराइए, पेरिफेरल स्मेयर कराइए, डेंगू कराइए, डेंगू आईजीएम कराइए, लिस्टीरिया कराइए, विडाल टेस्ट एंड यूरिन रूटीन, इस सारा पैनल करवाइए. It's always more beneficial to work on a larger picture, larger series of investigations. एक टेस्ट को आप लेके बैठ गए, उसको ट्रीट कर रहे हैं, बुखार ही नहीं उतर रहा है, then you are in a fix. आप क्या करें? आप फिर से टेस्ट ऑर्डर करते हैं. इससे बेटर है कि पहले बार में ही सारा टेस्ट करा लो. Day 3 या day 4 of fever, get everything done. Get your COVID done, get your RT-PCR done, get everything done on day 4, day 3 fever. So that's my humble request. That's my word of caution. That's my key take-home message. Sangha, can I have the next slide, please? So I think I have finished. I will be happy to answer any questions. I have not talked about leptospirosis because it might confuse you, but I have a word of caution here too, that in case आपका बुखार नहीं उतर रहा है, there is no localizing sign, please tell your doctor to get your leptospira antigen test. It is easily available. And one more thing I want to mention, that the government has come in with very, very effective national guidelines, and very good services are available at LNJPH hospital that we call as Maulana Azad Medical College, and Lok Naik Jayaprakash Hospital, which is the CDC center or the National Control Center for monsoon and communicable diseases. Thank you very much.
Thank you so much, Dr. Dolly, for sharing these information with us and for making us understand that how we can prevent these specific common diseases or infections that are monsoon borne and which are very common in this season. So just a quick guide for everyone. If you have any issues or anyone in your family needs help with any kind of health issues, Zyla is here for you. So we have our holistic health management platform in which we try to manage your health through 3 pillars, that is nutrition, exercise, and medicines. So please do reach out to us if you have any health query, and we would be really happy to help you with that. So now we would be taking up the questions that we have from our audience today. I'm also making everyone that you can unmute yourself. I have given you all the right to unmute yourself. If you have any questions, you can unmute yourself now and ask your questions directly as well. So taking up the first question that we have from Dr. Farooq. So Dr. Dolly, the first question that we have received is misuse of steroids systemic and inhaled for trial RTIs in Moonstone. Kindly elaborate. I'm not sure if, yeah.
So in COVID-19, a lot of inhalational budesonide was used, and cot was used for formoterol, but they showed very good results in relieving the spasm, the wheeze, and improving the oxygen concentration. But there should be clear-cut guidelines. One thing I forgot to mention, that during monsoon, sometimes the underlying asthma also crops up due to the change in the humidity and change in the temperature. Asthmatics also worsen, they start wheezing a lot. So coming to your question, Dr. Farooq, I would say that systemic steroids should not be used routinely. There should be a clear-cut indication. We have seen a lot of mucormycosis occurring during COVID-19, post-COVID treatment with steroids. Mucor has occurred in a lot of patients who were diabetic and in those who were ventilated and had low immune systems because of the mucor coming from the tubes, the ventilatory tubes and the other tubes that were inserted. So please be extremely judicious and consult a specialist before putting on systemic steroids. Look, inhalational steroids, if you're wheezing, if your concentration of oxygen is dropping below 90, maybe you can try because it's in micrograms, but definitely not systemic steroids. We have seen the side effects, the bad side effects of systemic steroids used during the Delta wave. And yes, a lot of people have landed up with a mucormycosis, which is a worse, very, very bad complication.
Thank you so much, Dr. Dolly, for explaining in that detail. किसी और का कोई सवाल है, आप कुछ पूछना चाहेंगे? Okay, so Dr. Dolly, we have few questions that earlier people had shared with us, and we would like to have the answers in this webinar today. So, जैसे हम देखते हैं, Dr. Dolly, आपने बताया there are different mosquito-borne diseases like malaria, dengue, chikungunya. So the question is that almost similar symptoms are there for most of these diseases. How can we understand that which test is to be done and when to get it done?
See, all of them have their specific antigens. We get them done on day 3, malaria antigen, you get them done, then dengue NS1 antigen, we call as the NS1, and then if you have passed the third day, 4th day, then the IgM antibody starts to appear. Similarly, the chikungunya also has an antibody. It is the IgM antibody which you can get done to confirm your diagnosis of chikungunya. So all the tests now are available, easily available, and in various forms of antigen from day 0 to 3, and then antibody test.
Okay, thank you so much.
If you have entered day 4, 5, then get the antibody done.
Okay, one more question.
Because the antigen starts to fall and antibody starts to pick up. Therefore, it's you have to understand which day of fever the patient is wanting the test to be done.
Sure. I hope that answers the question for most of you, because we as common man, we are often confused that the symptoms are reflecting for which of the disease and what are the next steps to be taken. Moving on to the next question. So Dr. Roy, nowadays, as we see, COVID cases are again on the rise, and how do we differentiate that? Is it COVID or it's just seasonal infection? Because many a times we keep hearing people say that अरे viral infection है, it's a seasonal infection. So how do we differentiate that?
आप RT-PCR कराओ और आप नाक से ही, नोज से ही वायरल फ्लू वायरसेस का अलग से एक पूरा पैनल आता है. You can get that. उसमें भी सब डिविजन्स होते हैं, H1N1, H3N2. सारे जितने रेस्पिरेटरी वायरसेस होते हैं उनका एक पैनल होता है, रेस्पिरेटरी सिंसिशियल वायरस, सारे वायरसेस के पैनल होते हैं. सो वी कॉल फॉर द वायरल पैनल एंड अलग से वी आस्क फॉर द RT-PCR फॉर COVID-19.
I hope that makes everyone clear that how we can differentiate COVID infection from the seasonal infections and what are the next steps that needs to be taken. Moving on to the another question that we have. So, Dr. Ali, people of old age, they generally do not prefer RO water or filtered water. They usually simply use water kept in matkas, right? So how to maintain the cleanliness in that case, as we also talked about the waterborne diseases here?
उसमें संगा आई वुड से कि आप पानी को एक लेवल तक गर्म करके ठंडा कर लें और फिर एक मलमल का कपड़ा या मसलिन क्लॉथ मटके के मुंह के ऊपर लगा के उसमें पानी छान के डालें. एंड जब आपका 2 या 3 बार के लिए मटका खाली हो जाए तो उसको अंदर से अच्छे से वॉश करके सन ड्राई कर लीजिए एंड फिर सेम फंडा यूज करिए. आप पानी गर्म कर लीजिए टू अ टेम्परेचर व्हिच इज अ लिटिल बिलो बॉइलिंग एंड देन उसको कपड़ा या मसलिन मलमल लगा के उसको छान के डालने और उसके बाद उसको ढकना जरूरी है मटके में. और क्लीन हाथ से और क्लीन वो एक आता है हैंडल जिसके अंदर में एक छोटा सा वो बना होता है कप, या उससे आप निकालें तो आप सब कुछ मतलब ध्यान रखें कि बिना हाथ धोए उस मटके से पानी नहीं निकालें, या आप टैप खोल रहे हैं तो कोई प्रॉब्लम
नहीं. थैंक यू सो मच डॉक्टर अली. आई थिंक काफी लोग ये चीज फॉलो कर पाएंगे एंड दे वुड बी एबल टू कीप अ चेक ऑन द वाटरबॉर्न डिसीजेज और इन्फेक्शंस एज वेल. सो एनी अदर क्वेश्चंस फ्रॉम एनीवन? किसी और का कोई सवाल है, आप कुछ पूछना चाहेंगे? आप अपने आप को अनम्यूट करके डॉक्टर डॉली से अपना सवाल पूछ सकते हैं. Okay, so if there are no more questions as of now, you can share your questions later on with us over Zyla application, or you can reach out to us over email or WhatsApp, and we would be really happy to help you with any kind of question or any kind of health issue support that you would need. Thank you so much, Dr. Dolly, for coming on this platform today and making us understand about the seasonal infections, common diseases that we encounter in monsoon, and what are the prevention tips. I'm very sure that all of the people who have joined today have noted down those tips and would be sharing them with their friends and family as well, so that they can also keep a check on their health. So thank you so much, everyone. Thank you so much, Dr. Dolly. Any closing notes from your side?
Thank you.
So on behalf of Zyla Healthcare and my co-host Sangha, I proudly, I'm happy to have addressed you all, and I'm feeling great that you had patient listening. And I hope you have some take-home messages, and I hope your doubts have been cleared as far as monsoon illnesses are concerned. So God bless you all, and good night.